Now for the topic of the day in Washington, which is health care. It is an issue that will affect and does affect everyone in this room personally. And I've actually operated on some people who are in this room. It is 17% of the economy of the United States, and there are two big problems. And the problem that affects about 85% of Americans is the cost of care. It's the cost, and we need to be focusing on that. About 15% is the people that don't have coverage, and we need to try to address that, but they're trying to address both of these things at once. By every government analyst who has looked at this, the 20-pound bill that is up there will raise health insurance premiums for people who have insurance. It will raise taxes by about $500 billion. It will cut Medicare by $500 billion. These are for our seniors who rely on Medicare. And there'll be more government control over our health care. Here's the bill. This is it. 2,074 pages, 20 pounds, 2 ounces. That's the wrong prescription for America. You know, I'm one of only 2 physicians in the United States Senate. There are things we need to do to improve health care in this country, but I would say do not be deceived. We cannot and should not pass a bill that limits our freedom and bankrupts our country, and I believe that's what this bill will do. I think we can solve these problems, but we don't need 70 new government agencies, which is going to result in about 150,000 more government jobs if this gets passed. There's some simple things we can do. First, you can allow people to buy insurance across state lines. University of Minnesota says if you do that immediately, they can shop around for things that work for them. 12 million more people will be able to get health insurance right away. Let those same people that buy their own insurance privately, let them get the same deductions as the big companies. Give people individual incentives so that if they stay healthy, that'll help them keep down the cost of their care and cut their own insurance rates. Right now, this includes a lot of money for what they call prevention, but it's to build sidewalks, jungle gyms, and street lamps. That's not the individual incentives we need. So there are things we can do. We need to deal with lawsuit abuse. It does nothing on lawsuit abuse. Something as simple as loser pays would make a difference. And finally, we need to let people group together, small businesses, to get together to be able to bargain effectively. I think this is so focused in the wrong place. We need to focus on patient. This needs to be patient-centered health care reform, not government-centered, not insurance company-centered. If we do patient-centered, that's the way to drive down the cost, to improve access, and to create more choices for people. Step-by-step choices and opportunities, step-by-step, to make the right thing, not a 2,000-page bill. And you know, there are so many, and I said earlier, don't be deceived, there are so many gimmicks in this bill. And I need to talk about a couple of them because you deal with every year. Medicaid, it is your biggest, probably your biggest unfunded mandate that you have to deal with. So I want to talk a little bit about Medicaid. Tennessee Governor Phil Bresnan has called Medicaid the mother of all unfunded mandates. So what is Washington's underlying premise on covering the uninsured? They're going to expand Medicaid by 15 million more people. They're going to be putting 15 million more people on Medicaid, and they're going to ask you to pay for it. Again, do not be deceived. There's another gimmick, a budget gimmick that they use, where they're going to collect taxes for 10 years, but they're only going to give 6 years of services. They're not going to start giving services until 2014. You know, try that one at home and see how long you get along with it, how you get away with it in your own states. Never going to work. But that's how they say we have kept the cost under $1 trillion. Take in money for 10 years, only give out services for 6. And then you've heard about the waste and the fraud and the abuse. They're going to solve this by dealing with waste and fraud and abuse for 20 years. For 20 years, people have known, and government accountants have said, hey, waste, fraud, and abuse in Medicare is awful. Now, that's the program for our seniors. 60 Minutes did a TV show 2 weeks ago on Medicare abuse and waste and fraud. And what they found is the drug dealers in Florida have now moved out of dealing in drugs and moved into Medicare fraud. And you say, why would you move into Medicare fraud? Well, because it's more profitable, less chance of getting caught, and if you do get caught, the penalty is less. These guys are criminals, but they're not stupid. And then I want to just talk about a little thing that I think really affects us in Wyoming, but everywhere in the country, and that's states' rights. This is government-forced insurance. Washington is planning to force people in all of our states to buy insurance. And the question is, should Washington have that right? Last week, Montana was the 20th state to introduce that draft legislation that ALEC put out, the Freedom of Choice in Health Care Act, and I'd recommend that you take a look at that if your states haven't looked at it yet. It will protect individuals, it will protect employees, it will protect providers, and it says that states' rights have an incredible role in this, not Washington. So this... And then there's the whole issue of rationing of health care. And I think you saw the recent guidelines that have come out by the government's Preventive Services Task Force. Said women between 40 and 50 shouldn't have mammograms, or at least the government's not going to pay for mammograms for women in that age group. And you go right through the bill, and it specifically says that, because the government task force, the Preventive Task Force, rates mammograms in that age group as a C, but the bill says it'll only pay for A's and B's. I mean, it gets convoluted in here, but this is a way to ration care. Well, my wife, Bobby, is a breast cancer survivor. Her cancer was diagnosed in her 40s by a screening mammogram. By the time the mammogram was done, the cancer had already spread. She's had 3 operations, 2 full bouts of chemotherapy, and she is alive today because of a screening mammogram. But yet the government says that the women of America don't need that, even though they admit that 1 out of every 1,900 women in her 40s, life would be saved by doing it. And that's how rationing comes into this bill. Well, we could talk about health care all day. You have other things. I want to take a couple seconds to talk about cap and trade or cap and tax. And I serve on both the Energy Committee as well as the Environment and Public Works Committee. And I think a lot about this. I think about energy security, I think about environmental progress, but I also think about economic growth for our economy. We need to make America's energy as clean as we can, as fast as we can, without raising prices for American families. And there's so much talk in the news about green jobs, renewable energy, wind energy, solar energy. Well, we need them. We need all of the energy. But for the people who aren't from Wyoming, there are times when the sun doesn't shine and the wind doesn't blow. In Wyoming, the wind always blows, but there are times when the sun doesn't shine and the wind doesn't blow, which is why we need the other sources of energy as well. We need a full energy portfolio that's diverse, efficient, sustainable, reliable, long-term, and comprehensive. So do we need green jobs? Yes. But we need to preserve and protect the red, white, and blue jobs that have powered this country for the last century. To me, cap and tax is just a scheme to raise taxes on energy, and it's going to hurt our energy security, and it's going to cripple our economy. It will cripple our economic growth, and you know, it will do next to nothing in terms of global emissions.